Welcome back to Sleep Better TV, and we continue our discussion with Dr. Mark Levy, DDS, who practices dentistry in Columbus, Ohio. And we'll be discussing pediatric sleep problems in this segment. Dr. Levy, welcome back. So can children develop sleep apnea?
Oh, absolutely. It's a big issue. We see kids all the time. The problem is that they can't be treated the conventional way. They can't be treated with a CPAP because they just won't wear it the vast majority of the time. We don't like to treat them with oral appliances because they're still growing. Their jaws are still moving, are still growing, teeth are still coming in. But there are many, many children out there who snore excessively. They don't sleep well, they're fatigued in the morning, and that leads into other social issues. We see it very frequently, kids who don't do well in school, kids who have what we call shiners under their eyes. You can pick them out. I can pick them out walking down the street. They have this sort of a lost look in their face. They walk around with their mouths open because they're having difficulty breathing through their nose, and they're struggling to breathe. The treatments these days are limited to tonsils and adenoids. For obstructive sleep apnea, that is. Got to have the tonsils and adenoids removed. The good thing is we see changes almost immediately. Believe it or not, bedwetting stops, grades at school improve, social aspects improve. On the other hand, another problem is convincing the pediatricians to write the request to an ENT, and a surgeon who will take care of the tonsils and adenoids, to do it. Most of the insurance companies require the children to have had X number of strep throats and ear infections before they'll approve it. But with enough push, the ENTs will go ahead and perform the surgery. It's incredibly important. I wish I would have known about the relationship between tonsils and adenoids when my daughter was growing up. The only other way to help a child, it's called palatal expansion, where it's an orthodontic treatment where it just sort of broadens the arches of their upper jaw mostly. It gives their tongue a lot more space to rest while they're asleep, and it solves the problem. Yeah, that's what we did with our daughter. Secondarily, we weren't trying to help her with her snoring or her sleep apnea. We needed her for braces. But once that was achieved, her conditions turned around.
I've heard people say that if your child snores, there's a problem. Is that correct?
Exactly. It's not natural. I mean, why would a child be snoring? They're not, for the most part, small children aren't overweight. They're not drinking. There's something else going on, and it just usually swollen tonsils and an enlarged tongue. Get that taken care of, get those tonsils out of there, and it changes their lives.
Dr. Levy, finally, some studies seem to indicate that OSA and ADHD may be related, and that some children with sleep apnea may be misdiagnosed with ADHD. Is that correct?
I think it's misdiagnosis because the symptoms are similar. The personality symptoms are very similar. And why not? Those tonsils and adenoids are doing nothing. We know that now. They do basically nothing for them. And if they're least bit snoring and they're on medications, or you're considering medications for ADHD, by all means, check into tonsils and adenoids.
All right, Dr. Levy, thank you.
Sure.
My guest has been Dr. Mark Levy from Columbus, Ohio, and you're watching Sleep Better TV.